Computer. Good morning, or good afternoon, or good evening, depending upon what time you're watching this. But today it is January, and we are here with Essence Healthcare. You can see it right here on my shirt. I am Diane Finnestead Ellis, and in the room with me today, I have two of my favorite clients. May I say your names?
Yeah.
Okay, we have Sandy Gussie and Sharon Santel. They've been clients of mine since, oh my goodness, a long time, we'll just say. And then also Courtney Hudson is in the room, and she is my newest addition to my team. She is my marketing assistant. Edith Voiles has been promoted to operations assistant. And then also we have the loveliest person in the room and my good friend. Here, I got to turn this so you don't see my extra screen behind me. So this is Essence Randolph from Essence Healthcare. Yes, folks, you heard that right. Essence Randolph works for Essence Healthcare. Yes, it's named after her. I'm teasing. It sounds like it is. It should have been. They probably should have done that for you. So my friend is in the room, and she's going to take us through a lot of different things with this. Now, have I admitted you into this Zoom yet?
No.
No. So yes, we'll send you the link, and then we'll get that in there. Okay, that bar in there is going to drive me nuts, and that light behind me is going to probably drive you guys nuts watching this. So hopefully, we've got this taken care of for you. So today, some of the things that I would like for you to know about Essence, and Essence Randolph can kind of chime in before she, because she's in the room here, can let me know how I'm doing with letting you guys know about Essence Healthcare. Essence Healthcare, what year was it that Essence Healthcare started?
I believe 2006.
2006.
Been in business 20 years.
20 years. Yeah, that's right.
2005.
Oh,
But
it's amazing. And so the way that I understand it is that Essence Healthcare originated here in St. Louis, and it was from doctors that wanted to create a different healthcare experience that was based on customer service mainly, that it was about the client when they decided let's do some things differently. And then when was it that Lumeris, which is an offshoot of Essence, that's really their technology that's coming from, and what's really behind all of the data and keeping all the data for all the clients safe, when so that was also a merge of talent that happens. And you can see the two locations are in Riverport area where all the concerts are, and also where you can go win money if you're lucky at the casino. It's right around there, right before you get to the St. Charles County in Maryland Heights area of St. Louis, close to the airport. If you've ever been in the St. Louis airport, for anyone who might be out of town, out of St. Louis that's listening. So what happened was these doctors got together and they said, what can we do differently to be able to serve the client? And one of the models that they had was the HMO model. They really capitalized on, and still do, that quarterback type of HMO model, where the primary doctor becomes he or she is not only your doctor, but they become an advocate for your health care. That means that when they recommend and refer to another doctor, a specialist, they are in the know of what's happening with your care. So there aren't a lot of questions about, well, what did they say? What did they do? All of that information is captured in Lumeris into the computer system that allows them to see a snapshot of everyone that you've been to and gone to and seen. So it was revolutionary for Essence to come out and have that as part of their mission as well as part of their process. Other companies that you might recognize, like Mutual of Omaha and also United Mutual of Omaha, they have looked at Lumeris in recent years and they said, wow, this is amazing. These are processes that need to go national. And about that same time, that's when Essence, it went outside of the St. Louis area and it began to grow and grow and grow into other states. So it's not just a place here in St. Louis, it is a place now that's considered a regional plan. So what are all the states now that are represented?
So we have Chicago, Illinois has its own plan.
Okay,
The
Chicago.
provider group there. We have Little Rock, Arkansas.
Okay,
We have Louisville and Lexington in Kentucky.
nice.
And I believe that's it. And of course, the St. Louis and Illinois areas here.
Yeah.
Yes.
So if you travel to any of those places, you're going to have a good time, and you're going to be really well taken care of if you have a really, really good time and something happens to your health. Because Little Rock is fun.
Right. And we've done some stuff in Northwest Arkansas. They have a plan in Southwest Missouri, like the Springfield area. Sorry.
Oh yeah, with Cox Health mainly. No,
Mercy.
it's Mercy
Yeah,
now.
we did have the Cox one, but
And now it's
we're-
Mercy. Oh, I love it. I love it. That's why we have these conversations.
Exactly.
You can tell that I concentrate in the St. Louis area and not in that area. So anybody that's down there that's my buddy, I'm sorry. We got it straight now.
And they have a PPO where you can see either Cox or Mercy, but Mercy is our partner down there.
Oh, okay. That's great. So if you're going down to Branson, you're having a good time. You can make sure that Essence is going to be covering you down there. That's a good thing. Or your kids or grandkids go to school down there. That's a good thing to have.
Right.
It really
And
is.
that's a good point you make, because even if you're a member here in St. Louis, if you're traveling to any of those areas, you have reciprocity. You can use any doctor in the plan.
That's down there.
Yes.
That's
Yes,
great.
as if they're right in your network.
Well, that's wonderful for people that are down at the lake and have
Exactly.
the lake houses and that kind of thing. There's so many in St. Louis that have Lake of the Ozark residences, and Lake of the Ozarks, my gosh, it's almost like it goes all the way down to Springfield to me. I mean, it's all over the place.
Right.
When they built that, I was like, well, what are they doing? They just wanted water, I think. So some other things to know about it. Were you able to send that, Courtney? Okay. Some other things to know, and you'll see Essence, a beautiful smile here in a second, is there are two different styles of plans. There are HMO plans with Essence, and there are PPO plans with Essence. So it's a matter of really today, when we deep dive, answering those questions. So Sandy and also Sharon, when you came to the meeting, what were your questions that you wanted to have answered for Essence? Today, when you walked in, you said, I hope we get this answer. I hope they cover this.
One is the M3P.
Okay,
I've had 3 different stories.
okay,
All doctors are $40 copays except for the doctor that is out of network for me. You told me I would have to pay 40% of his office visits.
Are you in the HMO or PPO?
PPO.
PPO. Mm-hmm. Mm-hmm.
Yes, that's it.
Okay. So for those of you that are listening, so we're looking at the copays. We're going to pay attention to those. And then we're also going to pay attention to the M3P, not an MP3. That would be, an older way of listening to music. But the M3P, that is the Medicare prescription payment plan for those that are going to hit the $2,100 maximum. That's what that is this year. That's the most you will spend on drugs that are on the formulary. So when you look at that, you're going to hit that $2,100, one of your options is to call your carrier, be it Essence or any other company, and to ask them, can I have what they also call vernacularly a smoother? And so the M3P smooths out the payments, so you're only paying $174 a month to your carrier. And then that way, when you go and pick up your medications, you're not paying anything. But we'll hear more about that later down the road. Okay, Sharon, what were your questions that you had?
me that?
Okay.
I'm expecting to do a sleep study, and she said that they would check with the insurance company to see if I could do it at the facility instead of at home. And then she called and made an appointment. So I'm really looking forward to that because I do not want to wear a sleep app machine. And they were explaining to me that there are different treatments for sleep apnea.
Yes.
And a probe or an implant into your tongue. And then when your tongue falls back and then the machine shocks it and makes your tongue go forward so that it opens your breathing. And he was like, you're gonna die if you don't start wearing sleep apnea machine.
Oh
And
no.
he pretty much scared me, but I don't not want to put a thing on my head because I have chronic headaches and I do not want to put a big rubber band on my head. She says that, oh, you won't feel it.
It's not, doesn't go around your head. I mean, it snaps here on the sides. It's on top of your head,
Right.
but your head isn't being compressed.
So I think, lately I have been reading the sleep studies also because I have so many clients that have been recommended the sleep apnea tests. And
all the things that go wrong with your body.
well, there's that. Absolutely. And paying attention to your doctor. So I commend you on that, that your doctor is trying to help you and get you what you need. Typically, the way that process starts is you do have a home test first, because that home test is going to give you basically what they would say in science, a homeostasis. And so it gives you a baseline as to where you are. And then they know what type of sleep study you would need in a hospital setting if you were there overnight.
A
Okay.
couple of years ago, and I declined to
Right.
join their little program.
But that's what they're doing. And I wanted to decline when they had suggested it to me, but I have found that that's what gives you that baseline. So, and baselines are very important. It's the same thing that we'll talk about when we get to the dental and the vision. And that is, a lot of people say, I'm fine. I don't need to go to the dentist. I'm fine. I don't need to go get my eyes checked. Yeah, you do. I'm fine. My hearing is fine. No, you need to go get a baseline. So if something happens and it changes, then they have something to refer to see where you were when you were healthy. And so that home test kind of acts like that. It's that baseline to go from, and then they can see what else they want to test beyond that. And that's the way that I understand it. But I am in no means a doctor and do not play one on TV either. So what happens though, with the newest thing that you're talking about, there is an implant that is newer, that's out there, and it's available. And for some people, it does work well, but there are many other options that you have, particularly because if you're a side sleeper, the mechanics of the sleep apnea traditional machine, and apparatus is not conducive to side sleeping, because you can knock it and you can put you can knock that, and then the pads under the nose have become popular too.
Sleep on both sides.
Yeah.
I can't sleep on my back.
And you don't have any issues keeping it in your nostrils.
I mean, you have to be careful and maybe place it, but
Yeah.
I have OSA, so I think when I have the mask on, I could sleep on my back, which I just found out.
Yeah.
But I'm a side sleeper.
So that's why sometimes they want you to come into the hospital. They want to see what your sleep habit is so they can see what is happening. So that would probably be the next step.
And there are requirements, Sandy tells me. I have to have X amount of sleep. Well, I was trying to sleep last night and I had to get up and go to the bathroom. Then I go back to sleep, and then I had to get up and go to the bathroom.
So that's something that you would discuss with your doctor, and you would say to the doctor, we're getting a little bit of feedback here, you guys, sorry about that. So you would say to the doctor, you would just let them know what's happening with your sleep pattern. And then the more that you tell them, the more they know, the more they can offer you different options. And that goes for everything. That open conversation that you have with your doctor, that rapport that you have with your doctor, and letting your doctor know what's happening and what's going on, they can absolutely do their job
And
to
he
their
had me
best.
right there. Everything that I've been doing was right in front of him.
Mhm.
And he had my history right there.
That's
Is that
wonderful.
what you're talking about?
Yes, that's what I'm talking about with Lumeris, the system that they use to capture all of your data. It is one that they can see all of your history right at once. So with HMOs, it's interesting when you have an HMO or you have a PPO, particularly with Essence because of that system. A lot of people think, oh, if I go to the same hospital, they'll have all of my information in their my chart. Not necessarily. It's just, it's hard to pull it all together. So with Essence, one of the things that we see, and I see with my clients over the years, when they go to the hospital, when they do a shift change from one nurse to the next nurse, when they erase that name, when they come into when you're in the hospital, they say, now I'm your shift nurse for the next, 6 to 12 hours or whatever it is. They're not asking you to repeat all of your medical history because they're able to access it easier than some of the other companies. So
Right
yes, so
there
it's
in their computer.
right there in their computer. So it can be very, very helpful for you.
Another question I think is, why do I want PPO as opposed to HMO right now?
Well, the interesting thing with the HMO and the PPO, and I'm going to have Essence kind of take that question.
Sure. So with the PPO, you have the option to, one, go out of network if there are doctors that are not contracted with us and that you want to see.
hello.
Excuse me. Hi. If there are doctors that you want to see that are not contracted with us, you do have the option to see them because you have the PPO product.
But you have to
Now,
pay more.
hey, thank you. Look at you. Come over here. Come on over here. That is exactly right. We have changed the product so that, yes, in a lot of cases, it is 40% co-insurance to use that out of network, but only up to that out of network max out of pocket. So there is a stop loss on that, but it is 40% co-insurance in a
What's
lot
the
of
stop?
cases. For the PPO, let's see, max out of pocket, 5,400 in network, 7,400 in and out of network combined. So say you were diagnosed with something and you want to go to Texas because the specialist for that specific procedure is there. An HMO member wouldn't have that option. You would, and the most you would pay out of pocket is the 7,400.
Cause, okay, just a doctor's visit. Diane went through my doctors and there's one that is, I guess, not a network,
Mm-hmm.
but I have to pay 40% of his office
Yes,
charge.
yes, and we pay the doctor up to the Medicare allowable. So I don't know what that is off the top of my head, but it's not like just any figure they want. Usually they'll respect the Medicare allowable for that service, but it is 40% versus a flat copay of $40.
Yeah, I've never had that happen before with the.
Yeah. Yep.
Okay, so that's an advantage.
The other advantage, you do not need referrals from your primary care physician to see specialists in or out of network,
Right.
which is that's
Oh, I
something
hate those.
you can go if you think you need to see a cardiologist, you don't have to ask your primary first. You just go make your appointment.
I do like to pump my primary doctor. Who would you prefer I see? But it's not really a
Requirement.
right.
Yeah.
Now, that's not to say, and I'll finish that. That's not to say that there wouldn't be a requirement from any specialist that you go to. They can still require a referral. They can require it, but the network is not requiring you. And you could also assume that prior authorization to see that particular place of, so it could be a provider that's a facility, could be a provider that's a doctor, a specialist, you still want to call Essence on the back of your card, customer service, and make sure that that particular place and doctor can be prior authorized for that reason. And I say that because when you get into elective and cosmetic versus medically necessary, those are three different categories. Elective, you're probably not going to get an authorization. Cosmetic, you're not getting an authorization. They don't want you to look pretty. They just want you to feel healthy. So that's when you get the authorization. And that's with any company right now. So prior authorization is still your friend. Don't confuse prior authorization with the referral. So the network is not, Essence is not saying you have to get a referral when you see a doctor, but the doctor can still say, I need a referral. And you as the member should probably get a prior authorization so that you can know how that's going to be billed to you and how much it's going to be billed.
Well, sometimes when I need something done, the office will take care of.
The prior authorization.
Yes.
Mhm.
Yes.
Because I think they can explain it better than I
Do they
can.
get the
Yeah.
authorization
Exactly.
from the insurance company or from?
They
the
do.
GP?
From the insurance company. Mhm. But especially when you get to dental, prior authorizations are your best friend because then they can give you the codes that you need, the description of service, and that way you'll know how you're going to be covered in dental. And then you'll also know if you need to have an extra plan outside of your insurance, outside of Essence.
Well, there was another consideration I have. I'm waiting to get my crown.
Mm-hmm.
I have a titanium implant
Mm-hmm.
in my maxilla, and he wants to make sure that it's round, everything's together.
Mm-hmm.
And March is my go and get my crown on it
Mm-hmm.
date. And when are the insurance companies gonna start kicking in for implants?
Oh, probably not.
Right. But I do want to say really quick, unless you have you need to finish a thought.
I used to be a dental assistant.
Uh-huh.
That doesn't really count for a lot. It was 50 years ago.
I didn't say that. I wouldn't say that. I'd say you're wise and good looking.
And I do know from experience working with the doctors that if you have dentures or partials, you may have an issue eating.
Mhm.
And if you cannot chew your food, that's not good for your body.
Absolutely.
And implants is really the best way to go, in my opinion,
Mhm.
to be able to eat corn
Mhm.
and not have it all go down your throat whole and chew what you're supposed to absorb. Why aren't they getting on the bandwagon?
I can tell you why. And it's because it's considered cosmetic. And I will also tell,
Inside your mouth.
so I will also tell you, well, it's considered cosmetic. And then also in order to be a dentist that can perform the process of an implant, you have different types of dentistry able to do that process. You have general dentists, you have prosthodontist, and then you have several different layers of it. So it's not a particular certification school to say across the board, okay, everyone has this education and you can do the implant. So so those two factors, not knowing what level of dentistry and what type of schooling a person has had, that makes it very difficult for an insurance company to take that on as a legality. And the fact that oftentimes the implant can be considered cosmetic. And so that's
Baloney.
I understand. But if we
Just make the point that if you can't chew your food, you're not digesting your food correctly.
I agree with you.
And
So
that affects your health.
I agree with you. I'm not disagreeing with you.
Let's fight about it.
No, I'm not disagreeing. I'm just letting you know what's happening in the medical perspective of it. Because if we could go to the dentist and all of those folks within that realm of of healthcare and say, this is what you need in order to do a medical implant. And if they could if they could have it separated from implants in general, then we might have something. But you'd have to go to the Professional Association of Dentistry and ask them to create that and do that so that it could then be something that a health insurance company like Essence and all the other companies could consider. So that's where we're at. But we have to unravel all of that in order to answer that question for anyone in America. And that goes for all topics. So this is a great
Somebody
segue.
advocating for implants to be covered with the insurance or
It's
partially?
a great question. Let me know, because this is my segue. So and that is that Essence and I, both Essence Randolph and I, and Essence Healthcare, and myself as an individual, as a broker, we belong to the National Association of Benefits and Insurance Professionals. So what we do is we listen to these questions and these needs all year long. And what we do every year is, as NABIP, we go to the national conference, and we're in DC on February 23rd. On that day, 1,000 brokers get together. We meet with all of our legislators across the country in DC. We are on the ground, boots on the ground on Capitol Hill. We have a one sheet. The one sheet has to be voted on, and it all has to be capsulated in one page. And we have to, in 15 minutes, share what are the most important points for America for healthcare. And we have to let them know what bills they can vote on that are coming up that they might be able to change in session and vote on those in order to support what we as an organization have come together and said is important. And there's many changes that have evoked and evolved from doing that process. And then in Missouri, we go down on April 14th down to Jefferson City, and all of us from NABIP in Missouri and the chapters in Missouri, we all go down and meet with the legislators there, and we let them know what we feel they should vote on that are the best options for healthcare and the bills for healthcare that are going to support those initiatives. So that's something that I'm involved with. That's something that Essence Randolph is involved with. And that's something that conversations like this,
So you
they will
go to
come
Washington
to the
and
table.
You've got a list, she's got a list, and he's got a list, and you guys got to put it all on one page.
We put it all on one page, and that's how it works for everybody that does advocacy in Washington, D.C. It all has to go on one page. Courtney's over there shaking her head because she just did the advocacy for voice, SDL.
That's usually what they do.
And what we found out, it's the pages that are there that really read all the bills before they highlight and say, this is what you need to pay attention to. And so
that are more important
absolutely.
definitely belong on the page, and some things that are not, and
some things that overlap with other organizations, so there might be something that comes up with memory care. And so we then would probably partner with Alzheimer's Association and say, are you lobbying for the same thing? Are you using your advocacy for the same reason? Are we feeling the same way? And so then if they receive from several different organizations the same type of energy and impetus for change, then they're more apt to make a statement, and it can really affect the way that they vote for their constituents. It's very.
Or I don't see them changing their mind before I am here to use.
They change their mind every day. And it is the influencers of our country that go there and talk to them every day. So 2 years ago when I was there, American Legion was there too. So we were talking about some of the plans that they honor veterans. And so they were there also talking about plans that were honoring veterans. So it was interesting that we happened to be there on the same day, and we could kind of tag team and support each other and say, oh, American Legion's coming in after us, or they'll say, oh, NABIP is going to come in after us, and they're going to talk a little bit about that too. So it's very interesting when they see a streamlined approach, but then they also see it bracket off per organization.
And you've done this before. Have you seen changes?
Absolutely. Absolutely. And then the big,
Still
beautiful
haven't
bill
helped
that
either.
has come out, there are definite changes that are available. And so it's interesting because of the way that that it works. You look at the year for Essence Healthcare and all the other healthcare companies. By April, they have their first draft of what 2027 is going to look like for their offering. And then by July is their second draft comes in. And then they can draft and change anything. Anyone can, any company up until October 1st.
As long as it's on one page.
No. Theirs is this big page. Woohoo! So, but no, that's separate. That's with NABIP and with advocacy. But when it comes to the healthcare and creating the plans for 2027, that's the way it works throughout the year. So by April, they've got their plans that come out. By July, they've got their second draft, and then they're making tweaks and changes until October 1st, when me as an agent and broker, we can talk about it with our clients.
Current dentist those years and the training. It's something that's close to my heart.
Of course.
And that I think is important.
Of course.
And I see so many people, you talk to somebody and they smile and you're like, oh, I wish I could tell you, you need to use dental floss,
Right.
And you just, I think we don't have enough education.
But I will tell, right.
For young people to take care of their teeth and their gums. It's a two-option product that they need to take care of.
So
more people lose their teeth to gum disease than they do to cavities. You realize that? That's
right.
really sad.
And that's why there's such an emphasis on dental for the over 65. That is why that is such an important component. And all the companies feel that way. And I would say that Essence, because they are local, they're able to do something that is very, very unique in our area. And I'm going to let you explain that about how that flex card works.
Oh, yes.
What is it?
So you guys are on both the PPO plans? Okay, perfect. So you both have $1,840 on your flex card. $1,840. That should be available as of January 1st, and you have until December 31st to use that money on non-Medicare covered dental, vision, and hearing services. Non-Medicare covered dental, vision, and hearing. So like your implant coming up. So
She can put some of that money towards
all of it if she wants, because I know those are expensive.
That's where it's
Medicare,
really unique.
Vision
and hearing.
That's very unique because you can use it for the implant.
And so I wanted to tell you guys, very important, if you should have received your flex. Were you on the PPO last year, both of these clients? Okay, so you need to, those flex cards you received, please call as soon as possible and verify that there is 1840 on the card today. Because I don't want you to go in March and you don't have the right card, you don't have the amount. Check it now that your balance says 1840. You should be able to call the back of the card.
Insurance card plus the flex.
Yes, sorry. Yes. So you have your one you show at the doctor's office, and then you have your MasterCard flex card. And that's the one I just need you to call and verify you have the money loaded as of
That's
today.
all we can use it on is dental and vision and
hearing.
Hearing.
Yes.
It's not an over-the-counter type of.
Correct.
and it looks just like a credit card. So it's,
Right.
you know, your MasterCard, and then there's an expiration date on there. So what I found out, it's really, really cool that I found this out, because I, you know, I opened my big mouth and asked a question. And I said, well, how long do you keep that Flex card? And if you were to go onto this plan again next year, then you'd keep the same card and you'd have the expiration date would be on there, just like a regular credit card. So if it expires, then you would have
If
it.
you don't use that 1840, you lose it by the end of the year.
Correct. There's so many ways that you can maximize that and
Is
use
it
that.
over the counter stuff?
No,
No.
Nothing.
no.
Mm-mm. No over the counter. So with that, what?
Can you use it for copay?
No.
No.
What
Mhm.
can you use it for?
Dental, vision, and hearing.
Some glasses, you know, the
I've had
prescription sunglasses.
I'm going to have some scar tissue removed from my right eye.
That would be
Because I had
surgical.
my cataract surgery and my right eye is not as clear as the left one. And that's gonna happen in March also. And is that something that the insurance company's not gonna cover 100%? And I can use that flex card to pay for part of it?
Typically, it would be surgical, and you would do a prior authorization to find out exactly how they're going to cover it. And then you would ask that question if it wasn't going to be covered fully.
And I still have my hearing.
Mhm.
Yeah, it's just fine.
That implant, do you know what your portion of that implant is gonna be in March?
I've already paid for it. $4,000.
Okay.
Mm.
Were you, okay. Did you,
But
was
they
United
paid for-
Healthcare able to help with that last year?
Yes,
Good.
Okay.
they did pay for the normal things.
Okay.
And, but the titanium and, now I think they'll pay for the crown. And I'm not sure,
Okay.
but it was for.
So you're already paid. That's already paid up.
Sharon, I'm thinking you're gonna have some fashion glasses.
Right?
I think you're gonna go and you're gonna be like, okay, I'm wearing yellow today. I'm getting yellow glasses. I'm wearing
Yeah.
pink today. I'm getting pink glasses.
Because I don't need glass. I started wearing glasses when I was 6.
Uh-huh.
I used them for my show and tell. They were red and white. They were so beautiful. I know. I use them. I walked up in front of the class and I put them on and I turned around and I went, I got glasses. My mom made a big deal out of it, you know. They're so pretty. Anyway, so when I had to finally get the cataracts removed, you know, they have to get so bad
Mhm.
before they'll remove them.
Right.
Well, there's an option to get this lens or this lens.
Mhm.
Mhm.
And that was $2,500 a lens.
Mhm.
And the insurance company didn't even make what they would have paid for this lens applicable to the more expensive lens.
Because it's considered
Sure.
cosmetic,
But
considered cosmetic
and that's-
by everybody, everybody. It's
It's
considered.
not cosmetic that I can read without putting on cheaters.
Again, it's that level of education and the cosmetic. It is, I agree, but it's that way across the board with every plan.
With study, it goes, wait a minute, I've got to put on my cheaters. Wait a minute, I got to put on my cheaters. Oh, here, would you read this? Wait a minute, I got to put on my readers. My cousin Patty has a pair of readers in every room in her house. My cousin Tony, she has readers all over the place. Because she had her cataracts removed. She got the less expensive, the lens that the insurance company will pay for. And she can't do this and she can't do that. I can thread a needle.
That's awesome.
Thread a needle
Mhm.
without glasses. That's not cosmetic. That's a dream come true.
See, and that is just the passion. That's the passion that moves the legislators when I go to Washington.
I'm going to Washington.
If you want to go down to the state level with me, you are invited.
Wow.
Anybody can go down to the state level. So then Jeff City.
Here because I can see better.
So you got the upgraded lens, and this is implanted. This is not
No, they're just like cataract lenses. It
Mm.
looks
She
like
just
a
said we got
contact
designer
lens.
glasses, like with flowers on
and
them.
it's and you take it in
Yeah.
and out?
The camera.
No.
Oh,
Yeah.
it's permanent.
Yeah.
Okay.
These are my non-prescription sunglasses, Dolce and Gabbana.
You're looking good, lady.
Flower. Okay. And then I carry a card for each eye that reads, I have special lenses for
Mhm.
cataracts in my eyes.
Hmm.
And they're here somewhere. Here's one.
And why do they need to, why would somebody need to know this so that they
Well,
don't?
if I'm unconscious
Uh-huh.
and I've got something in my eye, they need to know I have a cataract lens
Hmm.
Implanted.
implanted
Implanted.
in my eyeball. And
Okay.
one's for one eye and one's for the other eye.
Hmm.
And it tells you. Acrosoft IQ Plan Optics,
Interesting.
$2,500.
And they don't come out, huh? That's
No.
so cool.
They're
It
right.
is.
I know that. I thought cataract was just a surgery to remove something, but they put something on all the time?
And
Yes.
no, but you know what's really interesting is that they typically, oh no, I've seen it. I've seen another clients. They were like, I insist you see it, Diane. I'm like, yes, I got you. And so, but what's interesting is that some of the cataract specialists, those those particular doctors, they will suggest that cataract option first. And they don't suggest the option that's covered with the insurance first. That's the piece that I think is a little tricky.
That's
Well, again, ancillary to the medical, when we get into benefits, and benefits are dental, vision, and hearing. And when you get into those benefits, there's so many definitions that go with those areas of the medical field that I feel Essence as a company has really made a good move. And that is because they bracket it into a flex card for this year, so they're not policing the claims that come through. They're saying just spend it.
Safety of 40?
No, no,
That's
no.
covered by Medicare.
It's that's a medical procedure. So that I think that was a really smart move that they made to have the flex card and not to say, oh yeah, we're going to be part of saying yes or no to the claims that come in. And it actually, because they don't have a department that is searching through those claims and doing those claims, it actually saves the company, Essence, money, because they don't have to have this huge, ginormous team of people to search through all those claims. So the way when the money comes in from the federal government and it goes to Essence as a company, they have to look at, okay, what are our members going to use? What services have they used that they've liked? And then they can design the plan based on that. And so what they've done is they've also said, and how do we as a company utilize our talent of our people in a way that's going to support our members? Do we really want to pay people in claims, or do we want to train our members in customer service to be able to answer the phone? And to be able to answer the phone here, right here in the St. Louis area in the United States. Do our members want to talk to someone who is right here in our area? And the answer overwhelmingly has been yes to the Essence company. And what we've also seen is because of that commitment that they've made to shift everything and their resources to customer service, their star ratings in the past have been 5 out of 5. They looked at 3 years in a row that were 5 out of 5 coming out of COVID. And they were the only company in the St. Louis area that had that 5-star rating. That meant that throughout the year of those 3 years, anyone could come into their plan throughout the entire 12 months. It is significant. Now, a lot of people said, well, why doesn't Essence have their star now? Well, I'll tell you why. Because the United States of America, out of all the companies in the whole United States of America, there were only 3 that got the star, the 5-star rating. So they have really, really cut down as to who's going to get that star. And the reason why is because there's so much more money attached to achieving that 5-star that comes into the plan. So, of course, Essence as a company has said, let's concentrate on customer service and making sure that we have the customer service and not put that money over towards the claims for dental, vision, and hearing. It was the smartest thing that they could do to try and reestablish that they get that 5-star rating again. It is so great that you guys have done that.
Now, if I want contacts, how do I just have to call companies or optical? How do I know who's gonna take my Essence?
So the good thing about your PPO plan is you can go in or out of network. So in addition to that 1840 on your Flex MasterCard, you also have a $200 allowance embedded in your plan for eyewear or contacts.
So I only get
Yes.
$200?
So you have $200 that we give you in your plan, and then you have 1840. If your contacts cost more than the 200, you're welcome to use that. Please make sure that the provider accepts that
Yeah,
card.
but there's no book to look at to see who.
Because it's a credit card, it's like one of those merchant things. They have to, 1, accept MasterCard, 2, just, it's a WEX MasterCard. So you can mention that on the phone when you're making your appointment.
Because the last time I needed them, contacts, I went and got the eye test and everything done. And before I went, they said it was when I was with United Healthcare. Yeah, I'm covered. So just fortunately, when I got back onto the front desk, I asked how much they were gonna cost, and they said, oh, we don't take that insurance anymore, so it's $400. So I said, forget it.
Right.
And I went to Walmart, and I think it was $300. I had to pay $19 for tax. That was it, $19. Where this guy was gonna charge $400. So that's why I'm
Okay.
leery where I
I have
go.
to
and-
ask. But you have in or out of network. You get a $0 copay for a routine eye exam through your plan, and you have $200 towards eyewear or contact lenses. And then any overage, you can use your 1840 as long as they accept them.
So when I go in for an eye exam, any kind,
No, just
Okay, go.
routine. So
an ophthalmologist is gonna cost me.
it's gonna cost you either the in-network $40 copay, or if you use an out-of-network optometrist, it would be the 40% co-insurance.
And not all my doctors are on like my chart. My ophthalmologist, my dermatologist, orthopedic, they can't pull up on a computer to find out anything about me. They're all covered. But
Right. Are they different hospital
different
systems?
hospitals.
Yeah, they don't, for some reason, it doesn't sync.
Yeah,
BJC has theirs, and with St. Luke's, they have, yeah.
Well, they're all at St. Francis.
Oh, same.
Then I would call their St. Francis and just ask them,
Is she locked out?
ask them
I'm
that
sorry.
question. Yeah, she is.
Want me to get it or?
Yes.
Okay.
Okay, we're coming. So yeah, I would just call the hospital and ask them if there's a way to sync that all up for you. Mhm.
The hospital, not the doctor's office.
You could ask the doctor's office too and just say, where is this located in my chart? So, and will it be in the same, my chart? Hi, how you doing?
Okay.
Thanks for
Trying to be
joining.
late.
That's okay. Are you by yourself or you?
No, she's coming.
Okay.
across the street.
Okay, awesome. Very good. We just had some other folks join us. So, very good. So,
We have trouble trying to figure out how to spend this $1,840.
I'll call me, and I'll tell you how to spend it.
Okay.
I don't even know if I would use it.
Or you could call the Essence number, the customer service number, and just say, give me some suggestions as to how everybody's spending this. And Yeah. And there's other things too, that, when you go into a dental office and they accept the MasterCard, you can just ask them, what has everybody else been spending their MasterCard on? And it could be, anything from a cleaning system to a teeth whitening system or something like that. I mean, you just need to ask your provider.
It's not cosmetic.
Yeah.
Well, but that is a flex card. It doesn't matter. Doesn't matter. It's a dental expense.
So I have
And-
two dental insurance companies, but I should go in and give them the flex first.
No, if you have
No.
dental insurance that covers you, I would just use the flex card for the overage.
Exactly.
Yeah. If they say, okay, your dental insurance is, or there's usually nothing left after the to pay in your experience.
Mhm.
Is there usually nothing for you to pay?
Very little,
Okay,
but that's when I would use
the
the
flex
flex.
card, yes,
Mhm.
for any overage, that's your responsibility, absolutely.
Mm.
But make sure you guys verify your balances are there, and if not, call customer service, and also call customer service to get those Oura Ring sizing kits
Oh,
to your
yeah.
house, sent to you, so you
Well,
can
no,
wear
I
that
thought
for
I
a
heard
week.
she said to go through a portal, but she never said to get a.
Say, I don't use portals and computers, can you help me?
And then get the sizing kit.
Yes, yes.
And so for those of you that are wondering, what in the world are we talking about? The Oura Ring is unbelievable. It is, again, it shows the commitment of Essence Healthcare on the wellness of their members. And if you have the PPO for 2026, one of the benefits is to have an Oura Ring. What is it? It's a ring. It looks, just like a rose gold, a gold, a silver, and then also an onyx style of a color, depending upon what's available. And so here I'm going to show you what it looks like. Da-da-da-da-da-da. It's so beautiful. And look, Vanna. So a first of its kind smart ring, heart health, activity, temperature trends, sleep patterns, average blood oxygen, stress indicators, plus so much more. So here's the story as you're looking at this. So my client comes in and she says, Diane, this is really important. This Oura Ring is really important. And I said, what is it? She showed me and I said, it's kind of like, I said, it just does your sleep pattern, right? She said, no. She said, let me tell you what. She said, I was at a 4.7 on a 10-point scale. And then it showed me my sleep pattern. It showed me when I needed to eat, when I needed to have water, when I didn't need to have water. And also, I was weighing myself and it showed the differences in my weight and what times I was sleeping. And she said, and then within 4 months, I went to a 7.6 on a 10-point scale on the quality of my sleep. Wow, folks, that was eye-opening to me because you heard it from Sharon earlier that, sleep is so important. And so this can really help. So if you haven't ordered your kit, to get a size. Is it not a size? What do I need to say?
Call customer service or go through your everythingessence.com portal.
Yes.
Your member
the
portal.
everythingessence.com portal.
Because I.
You get the information from the ring.
We're gonna pull up. Can we go into Everything Essence? Are we gonna?
Should have received a new member guide, either via email or via
I
paper.
didn't see my. I got a booklet.
Yes, it is a new member guide that has information about Aura. It has information about the Flex card.
It does.
I have an example of it here,
Okay.
but that's where you get all that good information in your new member kit that you should
No, I
receive.
mean, when you're wearing the ring, and you said it'll show you all these things, where does that information show?
Oh,
The mobile app.
Oh,
that
yeah.
we pay for. We pay for your membership to a monthly app on your phone. That would sync with the ring and show you all these health insights. Absolutely.
So you're wearing the ring
Uh-huh.
and you bring up your phone and you click the app and you're gonna ask it to tell you how my sleep was, or
All those metrics will show on the app. It'll show your blood pressure that it's taking off the pulse in your hand. It'll show you that if you wear it overnight, it'll show you your sleep habits over time as it monitors that.
Yes.
Absolutely. You don't have to ask it anything. That information, once you register on the
It'll be
website,
right
it'll be
there.
right there.
Right
And
there.
you might have to refresh it, but
are you allowed to shower with it or wash dishes with it on? Is
I
it
believe it is
Yes.
waterproof. Yes.
Because,
We have it on all
losing
night.
it, so
If
for-
you
I
have
take it
been a
off.
member,
Mm-hmm.
will you still get the new member kit?
Yes, you should. Did you change plans or are you on the same plan for
Same
this
plan.
year? You should get a new
Mhm.
member guide because we have new vendors, new offerings. You should get that either via, if we have your email, I was told that would come electronically. If we don't have an email for you, it's a paper copy that should come.
Okay.
Yes.
And if you don't have it, you can call the customer service number
And
on the back of
request.
your card.
Absolutely.
Or you can even request it through everythingessence.com.
.com.
Everything. I mean, literally everything you need to know about anything regarding Essence, you can find on logging into Everything Essence. It is
Yeah.
unbelievable.
Just need to set up your account with your member ID number so that you can view claims, you can look at your flex card balance. It's all kinds of stuff on there if you're, willing to, do that technical part.
Okay, do you have to wear it on a certain finger?
The
Is one
preferred
better?
finger is this one, I believe.
Your index finger?
Yes, don't quote me, but I think it's this one, yes.
That one.
And please wear your sizing kids. I got one and I did not wear it for the week and I got my ring and I can only wear it on this one. It's too tight. I thought I had it and, I wore it for a couple of days and ordered and now it's not, I guess your fingers expand and do all kinds of things.
Well, with
So
the
mine-
seasons, humidity.
Yeah, so
different
please,
things cause it.
yeah.
Let's
Potato
lose
chips.
it.
Ooh,
Is it replaceable at no cost?
I don't know. We'll have to ask that one.
Mhm.
If you lose
I
it.
can walk back to the bathroom and forget what I went back there for.
Right. No, I get it.
Sure.
No,
I don't
they
know.
will. It's
I don't know.
like a $400 piece of jewelry.
Exactly.
I don't know if they're just
Yeah.
gonna, I'm sorry, I don't
Yeah.
know that one. I'm surprised.
I wasn't planning on.
Right.
Who plans on losing your jewelry?
I know.
Exactly. Oh my gosh. So we'll find out. So we'll put that on the list that we've got to find that out. My suggestion is don't lose your ring. It's kind of like your wedding ring, come on, folks.
Charge.
Yes,
Does
Yes.
it come with a charger?
it does.
And when do you charge it?
It lasts a couple days, so as soon as you'll know when it's not working. I forgot how, but
How long does it take to charge?
Like a phone, like a
yeah,
phone.
not long at all.
Mhm.
Not long
Minutes?
at all.
So.
Nope.
Yeah. Okay. So what I would love to do is I would love to just kind of go through this real quick. And so everybody is on the same page as this page. So I'm going to hold this up so that everyone can see what I'm reading here. And let's see. Yeah, if you'll pass that out, that'd be great. So everyone can see what I'm reading. And let me see. Everyone can see this column here. Let me hold it up like this. Okay, that's good. Everybody can see that? Okay, so when you look at the Essence plan, we're looking at the fourth column over from the left or the second column in from the right. So when you have the annual medical deductible, there is a 0 deductible. And right above that, you can see there's a 0 monthly premium for the Essence Advantage Choice PPO. The preventative care screenings are 0 for both in-network and out-of-network. The primary care physician is $0 in-network, 40% coinsurance out-of-network. The specialist doctors and specialist doctor visits are 0 copay in-network and 40% coinsurance out-of-network. Lab services are 0 copay in network and 40% coinsurance out of network.
Wait a minute.
Mhm.
What did you say for specialist doctor visits for?
So are you looking at the Royal Blue
Yeah.
Essence Advantage Choice PPO, 0 monthly premium? And it is the specialist doctor visits are $40 copay. Okay, so going on, we have inpatient hospital coverage is day 1 through day 7, $330 a day, and then 40% coinsurance for out of network, and then 0 copay for in network, and then for days 8 and beyond, and then 40% coinsurance for out of network. Outpatient surgery at an ambulatory surgical center is $295 copay and 40% coinsurance out of network. The maximum out of pocket is, and this is the maximum out of pocket limit. A lot of people call that a MOOP for maximum out of pocket, and that is $5,400 per calendar year in network, and then $7,400 per calendar year in and out of network combined. Now, for prescription drugs, a preferred retail is a 30-day prescription. A standard retail is a 30-day prescription, or a mail order is a 90-day prescription. So tier 1 drugs are either $0 for preferred retail, $4 for standard, or $0 for the mail order. And then a tier 2 generic drug is $5 for preferred retail, $12 for standard retail, and $10 for a mail order. Tier 3 preferred brand drugs are $47, both preferred retail and standard retail, and $94 for mail order. Tier 4 non-preferred brand is 50% across the board. Tier 5 specialty drugs is 29%, and you cannot mail order the specialty drugs. Tier 6, that is select care drugs. Tier 6 is not offered in this particular plan. Insulin's covered under tiers 1 through tiers 5. And then catastrophic coverage after your yearly out-of-pocket costs reach $2,100 for all the drugs that are on the formulary for this plan. You pay $0 for all covered Part D drugs. Cost sharing may change depending on the pharmacy you choose, and it could change throughout the year depending upon the cost of the drugs as it is adjusted throughout the year. So the thing is, now let's kind of digest that and let's talk about the drugs. If you get a drug that is not on the formulary, then you probably will want to reach out to me. And one of the steps is you would go to Essence for an appeal, and you would say, I'd like to appeal this drug, and I would like to get this drug added, and they would assign a tier level to it. Sometimes when they assign a tier level, the problem is that you could still get that drug sometimes for a lower cost, not using your drug plan. So you do need to let me know what drug it is so I can do a search, or give you the tools to do a search. And we're going to look at the manufacturer's coupons to see if there's anything like that, a trial, anything like that that's available, if there's a substitute that might be available. And excuse me, also, if you would be able to get it possibly from a company like Cost Plus Drugs, or through GoodRx, or through the Canadian Med Store for a lower price. So I'm happy to help you with those kinds of searches. You just need to let me know what medication it is and what you've been quoted from the appeal. But the appeal is the first step.
I have type 2 generic I just picked up. And this one says, up to $10. I paid $20.
Okay, what pharmacy did you go to?
CVS,
And was it a 90-day supply,
30.
30-day supply?
Because it's 90, but I take 3 a day. So it's for 1 month.
30 days.
He just got a 30-day supply. I wonder if it's a non-covered drug for her to.
No, it's three, you take 3 of them a day. So actually you save $10.
Wow, I paid $20.
So, because if you're taking 3, I'm thinking that if you take 3 drugs, one drug, 1 pill a day is going to be the $10 amount. 2 pills a day is going to be the $20 amount, and 3 pills a day might be the $30 amount.
Prescription
So-
amount of pills.
I don't know how they did it, but that might be what happened. And so you want to ask your pharmacy, how did you come up with the $20?
Because Essence told me it was gonna cost $166 when I talked to them.
For a tier 2 drug?
It was pregabalin, and she looked it up, and she told me, 90 pills for 1 month would be $166.92. And then when I went to pick it up, it was $20.05.
How do I spell it? I just.
PREGALIN.
It sounds like it's coming into a tier 4 drug. For that price, it's at the 50%. It's a tier 3. I don't know.
Percent, that means it's only $40.
Unless they were able to give you a drug discount card there, and they use that instead of charging it to
This
The
one I get
Essence.
confused. This is, so
yeah.
$10 and then I paid 20.
So you want to ask the pharmacy.
See the.
Yeah, we'd have to see the receipt.
Because that's very odd.
Mhm.
It is. I mean, I'm glad you
Not
paid
for
a
us.
low amount and got out the door, so let's not rock the boat.
CVS one.
I mean.
Hey, can I come back next week? I love it.
Are they gonna catch up with you and make me pay next time?
Hey, you. You with the good drug cost.
That's why I get confused.
That is, but I would ask.
And it should have been,
Rock that boat.
something I wanted to mention, that fine print there on that drug coverage, that I want, everybody in here has a PPO.
Uh-huh.
Yeah.
Uh-huh.
So there's a $340 deductible in January 1st, yes, for
Mhm.
tier
So-
3 through 5.
I never reached the 2,100, so she told me to forget about that. So if I, keep paying for this, a few of them, and then when I reach $340, like my inhaler would be $387. Once I hit my 340, paying my 340, it goes down to $47.
The tier 3 copay. Yep.
So I mean, if I was paying 166 for that one drug that I just picked up, it wouldn't take me long to get to past the 340.
Right. That's
But now
really
that-
great.
But it's the 340 is going to be assigned to you to pay before you get your access to your tier 3 drug. So that's the way it is. If you're only taking tier 1 and tier 2, you're not going to ever pay that $340 chunk out of your pocket.
Most of mine are free,
Okay.
Right.
Mm-hmm.
so,
Yeah.
but like if I'm only gonna pay $20, they're gonna take me a long time to get to 340.
Mhm.
But you're not getting to the 340 amount. The 340 amount comes when you take a tier 3 drug. You're not getting up to that level. That's not a maximum that you have to meet. It is assessed to you when you get a tier 3 drug, you're going to pay $340, and then you pay for the tier 3 drug.
Oh, so the one I picked up doesn't count.
No.
Well, it is, it's a tier 3 in our formulary.
I know,
That's
it's
a
just-
mystical situation.
It's a mystical situation.
That one is tier 3, I'm looking at the formulary. So I would have thought you'd been hit with that 340 that day, but you were not. You paid $20 and
Folks, this is why people need a broker. This minute, this is why they do, because these things happen. And guess who gets the call? Me. And I'm so happy to have the call. I'm so happy to have it. America, they can't do it on their own. They cannot do it on their own. Do not make them go to a website. Say it loud, say it proud. Go, go, go.
And the odds that they'd have charged her $20? Would they have charged her 47? Would they have charged her the $166?
Well, tier three, whether you go, it looks like on your chart, you see tier three. It says whether you go to a preferred or a standard, which means CVS, which is preferred, or Walgreens, which is standard, they're both 47. So in that case, it's still.
So for me to do,
Still a mystery.
I should get my inhaler filled, pay $387, and then all the other ones knocked down.
No, you should probably get your inhaler maybe off of the formulary if you don't want to pay the $340. If that's the only drug that is causing you to pay the $340, then we need to do a search and see if we can get it find it cheaper for you. Does that make sense?
No.
Because if
Don't I
you
want to get to my 340?
no, you're not trying to get to your 340 when you get your tier 3 drug. So I'm going to go get, let's say I'm 65, I have Essence, I'm going to go get my tier 3 drug that is, I don't know, what's a tier 3 drug that everybody takes? Eliquis. Maybe. And so I think it is. And so, so I go get the Eliquis. Before I get that Eliquis, that's when they want the $340. Wham, bam. Pay the $340, and then you pay $47 for the Eliquis. Does that make sense? So when you go get your inhaler, it's wham, bam. You got to pay the $340, and then you've got to pay the 47, or it would be 50% if it was in that category for tier 4. So if we know you're going to pay $387 to get your inhaler, then if that's the only inhaler that you need for the rest of the year, let's do a little search and see if we can get that inhaler for less than $387. And then you've saved yourself some money.
Now, when I called us and she's the one that gave me that price, why wouldn't she have told me a cheaper, a lower?
That is part of the mystery. That's it. That's part of the mystery. So, but I will say this, that if you don't like anything that anybody ever says when you call customer service, say thank you very much, hang up and call back and ask the same questions and get a recorded line. And then get the person's name and number and get a reference number for the call.
What are they called? You have to go through to get to somebody. It's not, it's not, hello, this is Essence. You have to ask, I bet they asked me 6 questions before I got to a person.
Okay,
And
that happens.
pain in the butt.
So, yeah.
Is there
But-
an option that says, I don't know, and you can just bypass all those questions?
At the end, after, you've answered a bunch of questions, and then it says, what else? And I'll say, speak to rep.
Okay.
But again, your pharmacy should also know what the cost is for that particular drug too. So you can always call your pharmacist.
Well, they do know. I mean, they charge me the $20.
And that's amazing. I'm going to see that pharmacist today.
It's very frustrating that this is so complicated.
Mm.
Who do they think they're playing with?
Exactly.
We
That's
are
why you need a broker. You need a broker.
Is everybody going broke? You don't walk out without paying $100. every time I go to the grocery store. I had the lady come my hair yesterday. She has 3 little girls and they spend $300 a week. And then she says I have to go back Wednesday and get milk or something that wasn't on the grocery list or something. And I'm like, I don't know how young families are doing it.
Well,
And now you've got us jumping through hoops with these 47 and 20, and this operator doesn't tell you the same information that that operator tells you, and
mhm.
implants and contact lenses for cataracts or cosmetic.
That's why I love that Diane is having these meetings with you all. This is a very nice courtesy you're doing. You have, she said, Essence, yeah, I know you have your own job, but can you come meet with my clients and answer their questions and guide them? And like, this is for you all. So please,
We need every bit of it.
Yes, and she knows I'm a phone call away. I'm her
Mhm.
liaison to the plan. If ever you guys have any trouble, she knows she can call me. I'm her
Mhm.
go-to. So we are here for you 100%. It is a privilege that you guys are enrolled in Essence, and we don't take that lightly. So if you need me, Diane, we are here for you and value your.
Because I want you all to know that I don't work in a vacuum. I've got all of this support around me all the time with wonderful people. And this is where I need to let y'all know about Essence, because she's never going to brag about herself, but I will brag to you about her. So last year I called her and I said, Essence, we have an opportunity to go to the leader for the leader paper and to represent, Essence. And I said, I know that I usually have my own booth, but I know you guys usually have a booth. Is there any way that I could do a booth? And she came back and she said, Diane, you can do 4 booths. You can do 4 of them. We want you at all 4, and I'll be there too. And then she added the St. Charles event as well. And then we also did an event out at Act Two Theater. And this was my second year to be out there. And every time, she's a good luck charm. Every time that we are together, we reach people and we talk to them and we get all their questions and all their unanswered questions, and we have a ball together. And it's because we share the same passion for service, that we want you to know that that's the number one reason why we're motivated to get up in the morning, is to serve others. And so I will let you all know that because Essence does such a wonderful, wonderful job, there's a long line of people that want her job. And I'll tell you why. And you're so good at it. And the reason why is when I go to conferences, across the country, they'll say, Diane, oh, you're from St. Louis. And I'm like, yeah. And they're like, oh my gosh, you do realize that St. Louis is the 3rd market for any plan to be released in America. And it's because we have 5 hospital systems. And so we have Mercy, we have SLU, St. Louis University, we have BJC, Barnes Jewish Hospital, with Washington University, we have SSM, and we have St. Luke's. We are so blessed to have all of that healthcare at our fingertips. I mean, we can just jump and there's a hospital right across the street, literally today, from where we are. And we are very, very spoiled, and we don't realize the goodness that we have here in St. Louis, the mecca of healthcare. But America realizes it. And when a broker, especially if it's a local broker that is surrounded by all these national companies, as Essence is, and she has the ability to say, this is how we're unique in our area and in our market. And then everyone around here is going, well, what else are you doing? And she's able to say, and we have a data system that supports us, and we have doctors that have started this particular healthcare system. It is one where her job is very, very unique because she is serving St. Louis, and then it emanates out from there to the other markets. So everyone is looking at her position going, well, what are they doing? what's Essence doing in St. Louis? Oh, you have Essence. That's where Essence is from, Diane. Oh my gosh, we've heard of them. They're so good. They're so good. You know, they really love their customers. They really want to answer the questions. They're really out in the community. They want to provide the education. They support their brokers, yada yada yada. And I'm like, yep, 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 yep. That's us. Move to St. Louis. You know, yes, but don't. And so it is, I really have to let y'all know how lucky we are because we do not realize that until we step out. Like I was at a national conference and I was there meeting the CEO of Alzheimer's Association. She said, "Oh, you're from St. Louis?" She said, "That's where Washington University is." She goes, "That's where Essence is." And the reason why she said that to me is because the partnerships that have started in St. Louis that they have for example, the home health care partnership, they have they have only local companies that they've worked with for years and years and years. Now it has spread out to national companies, but originally it was local companies. And so this particular person from Alzheimer's Association knew the commitment to the local company and knew that local company had been committed to the training for dementia as well as for Alzheimer's for every single one of their caregivers. So it was just amazing the things that people know about St. Louis and the medical field when I travel. It's just awesome. So I have to give you that plug because you deserve it. So
Thank you, Essence.
oh yeah. So a couple last things that I want to go over so that
Keeping this.
that's yours. And then the couple last things I want to go over. So we have the extras that we went over, and that was we talked about the hearing and the dental preventative and comprehensive on your Flex card. We talked about a $20 copay for the hearing exam. We talked about how you get an additional $1,000 every 2 years for hearing aids. And that's also through the company called Amplifone, if you use Amplifone. So
Hearing aids gone down. I hear these ads for hearing aids that are $1,280.
but it just depends on the properties of the hearing aid. So if you get
What
a
your needs
noise,
are.
yeah, if you have a noise canceling system where you turn your face and then you can hear that and then it does make the ambient noise go away, then you're usually looking at much higher prices. So, but it just depends on your needs. And then vision, there's a zero copay. And then eyeglasses, we talked about that, $200 a year in addition to the Flex card. And then the Flex card, you have the $1,840 on the Flex card to use for dental, vision, and hearing. And then you also have the Oura Ring, where we said order the kits. Transportation beyond ambulance is not covered. So you can't just order an Uber and then charge it to Essence. That does not exist. Fitness. So let's talk about this because I love this. Fitness is with Silver Sneakers. Silver Sneakers has been a partner for many different companies for years. You want to go onto silversneakers.com and check it out. If you ever want to nominate a particular organization or a company to be part of Silver Sneakers, there's a nomination section on there. Also, if you need meal plans, if you want to participate in classes online, you can. Chair yoga is one of those classes. I've done actually one of their chair yoga classes. It's chair yoga. And then so you're in a chair, but you're doing yoga positions in a chair. Yes, it's fabulous. So, and then another thing that's on there is Sage Scholars. So Sage Scholars, when you go on to Silver Sneakers, you want to let them know that you have gone to the gym at least 7 times every month. And you sign up for that program to inform them. And even if you go to the gym, you get a donut, it counts. The steps count in and out, just give them your card. Go get some new friends. Eat some donuts at the gym. So don't do that, people. Okay.
You're they give you a donut. You know, kind of Powerball.
I've been invited to Crunch.
Oxymoron.
I Crunch Fitness at 7:30. They're like, Diane, come see us. Bring the donuts. And I'm like, okay. I'm like, we're gonna crunch some donuts. So they're like, yeah, yeah. It's hilarious. I am going to take them up on it. So anyway, there's many gyms around the country that are involved, but the way that the Sage Scholarship works is you go in for 7 times a month, and then at the end of the year, it can be 1,000 points, and it can convert to $1,000. And then you can give that scholarship to yourself. There's over 412 colleges and universities where you can use that scholarship. And so one of my clients goes, oh my gosh, Diane, my grandson, he's going to have a Italian student, exchange student next year. She said, that means this year I can earn my ability to pay for my college tuition and learn how to speak Italian. And I'm like, oh my gosh, yes, do it. So the other funny story, so nah. And so anyway, so this was really great that she was going to do that. So the other funny story was one of my clients, I said, you need to start doing silver sneakers. They have the meal plans online, and they have all this stuff. You should sign up for it. And she said, oh, okay. I said, but you really should listen to your doctor. You should go to the classes and do this. And so she calls me, and she is 83. And she calls me and she says, Diane, I am now doing Tai Chi 3 times a week. And I'm like, really? And she said, yeah, I go down to Forest Park and I'm there. And she said, and then I go over to Clayton and I'm there. And she said, and then I go out to West County and I'm there. And I said, 3 different places? And she goes, yeah. She goes, it's silver sneakers. I can go to as many places as I want. And I said, that's great. And then she said, I said, who's the instructor? She goes, oh, he's gorgeous. It's the same instructor. He's gorgeous. And
She's benefiting from Tai Chi. I understand it's supposed to be very.
she loves it because it's not hard on her joints. She's done the Tai Chi walking, and she's now added her, the hands that go with it. She goes, years ago, I used to do ballet. And she goes, it kind of feels like that. So I'm like, oh, that's good.
We lived in Venice. Yeah. Some people moved in, and their backyard was across from our backyard. And very early in the morning, this elderly Asian lady would come out on her stoop and
Oh, I love it.
do all this stuff.
Mm.
And it was like in slow motion, and she
Mhm.
did it every morning. And
Yeah.
I always felt so jealous how she got to go out there and do that.
Yeah, yeah.
Self do those things.
It's so wonderful.
Andy and I tried belly dancing one time.
I'm sure we were thinner.
One of my friends that is also another part of Miss Medicare, one of the 200 ladies that we all get together every summer up in Ohio. She does pole dancing, not for, like anywhere else other than, in the studio. But oh my gosh, I'm like, how do you do that? Because she was taking it for, circus acrobatic type of thing. And just for her to go upside down, I'm like, how in the world? And she's like, well, you got to work yourself up to it. I said, even if I work for 30 years, there is no way. Oh, I don't know how old she is. I think she's probably in my age. So I know she just, I was like, holy moly, I can't believe you did that. And then she did this little spin thing. And I'm like, oh my gosh, you could be on America's Got Talent.
It's not silver sneakers, right? Pole dancing.
I think there might be a couple classes. I don't think it's limited. There's no age limit. If you can do it, do it. I say, do it. Oh my gosh, too funny. So, okay, so this kind of wraps up everything that we wanted to cover, but is there anything that we didn't address? that you wanted to have addressed? Any last questions? Okay, so Essence, tell us what you're looking forward to in 2026 and 2027. So as far as this year with reaching out to the community and where we might be able to see Essence this year, and also things that we can look forward to as a member, where you would say, whatever you do, don't let that particular benefit just sit there. Make sure that you use that benefit, because we really feel it's a good one.
I'm gonna go with the flex card. I know you're now brainstorming of how you're gonna use your 1840, but yeah, let's not let that go to waste. I definitely want to hear feedback from members about how that experience is, how you like having the freedom to choose where you use your benefit versus us saying, okay, this 1840 is broken down here, here, and here, having that freedom. So I'd love to hear your feedback on that. It sounds like it's going to be a bit different trying to decide where to use it, but hopefully.
Yeah, where? and
Yes,
so forth.
yes.
Yeah.
I want to hear how you spend it.
Yeah.
I do too. I'd be curious. That's your project. Yeah. So that's what the benefit I don't want members to by December 31st, let's use that up. It's yours to use. I'm excited about this year. We brought in some plans, like the Oura Ring is in more plans this year. Transportation is in some of our HMO plans. There's all kinds of new vendors like Liberty for dental and things. So I just want to make sure everything is working right, with these new partners.
Or getting to the doctor's office.
Yes.
In the other
In some other plans, yes.
And they're using Uber.
Yes.
So
Yes. Great. Yeah.
yeah.
So, something to think about. I mean, we talked about the positives of your plan and why it is, those plans don't have those opportunities to go out of network or not need referrals. So you have to think about what's important to you with your choices, of course. But for 2027, I mean, it's just January, Diane.
I know. But it makes me give you a plug, and that is every year in September, about September 15th through October 15th. And Essence has been really, really great about getting this out early. And that is your ANOC. It is the annual notice of change that comes out. And several of you have said to me, you're like, Diane, we don't like it to where when it just shows what the difference is from the last year. You want to see the whole list of all the benefits and the whole list of all the benefits. That everyone has said that. So that way you can easily see the changes from year to year and compare it. But make sure you get that. And then when I have my education classes in the fall again, then you will bring your ANOC with you. And it makes it that much easier. So we've already tried to look at this fall and what we might do differently. And I think that we're probably going to have 2 ginormous education sessions. And I mean, they're going to be huge. It'll be probably 150 clients in one and 150 clients in another, sitting in recliner chairs with a stage. So we can knock it out instead of having like 12 days that are devoted to it. So, and then hopefully we can talk whoever is going to host that event, we can have a happy hour that's hosted by a vendor ahead of time. So we're working on it. We're moving on up.
Different, what happened to over the counter? Why don't we have over the counter money anymore?
For the PPO plans, to be honest with you, I just speak frankly, it is what it is. We have moved back to Essence's root of HMO products. So a lot of our investments were in our HMOs with our traditional coordination of care, where the member, the primary care physician, and all their specialists are under the referral program. And so a lot of the Uber, the over the counter are embedded in those HMO plans for 2026. So that's those, and don't get me wrong, it's not hundreds of dollars. I believe the highest is $45 per quarter. for OTC in the HMO plan with the highest OTC amount. So it's just not where we put the dollars. We put the dollars in the flex card, in the maximum out of pockets. Yeah, that's
I think that was one of the best things.
okay. It's good
that
feedback to
y'all
know.
were doing. You need cough syrup and you need incontinence supplies and you need
Right.
vitamins, and it was so lovely to have that taken off of your bill when
Noted.
you got to the cash
Mhm.
register.
It's good feedback.
Yep, yep.
It's really
Yeah,
good feedback
It is.
because there's other people that said, I never use that, Diane. And I'm like, oh my gosh, I will come to your house. We will go shopping. Oh, come on. I will tell you when I'm going to be at Walgreens. Meet me there. I'm there every Wednesday.
Yeah.
I know, right?
That is so sad.
So Sandy, if I find someone, and Sharon, if I find someone that doesn't use their benefits, I'm gonna say, here's my friend for you.
Okay.
I am serious.
Right?
I'm serious. We can get creative on this thing. Right, America? It's called Get a Buddy.
I didn't hear that.
And I said, no, Diane's in trouble now. Diane, you are bad.
I can imagine that if you would poll 150 people in the room, that the majority would say, oh, I loved that.
It's just, it's six of one, half dozen of the other. However, I will say it per plan, it's different. A lot of people really liked the over the counter that they have had with Essence, with that experience. And the other companies goes either way. So,
I was with one that they did, were you with it too? $300?
oh yeah, yeah.
$45
And
a quarter.
we'll see that the over the counter is going to be shifting lower, and you'll also see the drug plan maximum at 2,100. Last year it was 2,000. So this year's 2,100. Where do you think it's going to be next year? So you start to see these trends and shifts. What's really interesting is that I have all my cheater sheets because I'm a geek, and I have, all my cheater sheets of all the different companies and what everybody has and everything. I have all of those back to the beginning of when I started and back in the business full time in 2014. So I was part time for 10 years. And then prior to that, I was full time. So I've been in the business now, over 25 years. I can't believe it. When I was in diapers. And so, but it's interesting to see the trends, and then you can start seeing the shifts of all of them from the different companies, and you can see which companies will stay right with it. And what you're looking at is the core copays of Essence really have not shifted. They really haven't.
Though, to meet it.
Yeah.
I mean,
yeah.
I would never make the 2,100.
It is difficult. It is difficult to meet the
I guess that's good that I don't have to spend that much, but
the actually meeting the drug deductible is not as difficult as it is to meet the maximum out of pockets. For the plans, the maximum out of pockets, very few people max out their plans.
doctor's appointment.
Yeah, for the medical. Yeah. So yeah, it's
heart attack and you'll make it.
as they say, to each his own. Again, folks, why everybody needs to have a broker, because you can't just say, hey, this plan's right for everybody. No, it's not. It's just not. Some people like pizzas, some people like hamburgers, and some people like salmon, and a salad. So, that's what we like to order off of a menu. We like to have choices. And I would hope that the 40 quarters that everyone in this room has worked, and the 40 quarters of everyone that's going to listen to this has worked, that they know that we want to listen to you. I want to listen to you as a broker, and the companies value you, value your feedback, and want to listen you as a broker. And now Edith and Courtney have just arrived. Say hello to the whole team, everybody. So with that, we are gonna, there's Edith. Say hi, Edith. So, okay, with that, we're going to let you guys go. And thank you so much for being with us today. And we look forward to a wonderful 2026. All right, everybody, take care. Bye now. Oh, you guys are welcome. Thank you. We love you. I love you. Mwah.
Oh,
Oh, and always phone on the other end.